Struggling with headaches? Well, you're not alone. Over 95% of Americans will experience them at some point, leading to a fervent search for relief. There is hope. Did you know that understanding the difference between primary and secondary headaches can be the key to finding the right treatment and relief? In this video, we'll uncover the causes, symptoms, and most effective treatments for headaches so you can get back to feeling your best self. Treatments range from vitamins, minerals, nutraceuticals, which are found in supplements such as magnesium, CoQ10, as well as even seeds, to common medications like NSAIDs, which include ibuprofen and naproxen, to even including electrical stimulation and specific exercises designed to bring comfort. That's just the tip of the iceberg. Understanding headaches. Identifying the culprit and taking action. Headaches are a universal human experience, but the impact and types can vary dramatically. Did you know, according to the Migraine ID trial, that three simple questions can help identify migraines with a 93% accuracy? Here they are. 1. Has a headache limited your activities for a day or more in the last 3 months? 2. Are you nauseated or sick to your stomach when you have a headache? 3. Does light bother you when you have a headache? If you answer yes to 2 out of 3 of these questions, there's a high chance that you're experiencing a migraine. While most headaches aren't a cause for alarm, some symptoms require an immediate visit to your healthcare team. Remember the mnemonic Snoop 4. S. For systemic symptoms like fever, chills, muscle aches, weight loss. N. For neurological symptoms like numbness, weakness, slurred speech. O. Onset after age 50 years young. O. Sudden onset like a thunderclap headache. P. Eyelid swelling or positional worsening of the headache. P. Precipitated by Valsalva maneuver, meaning straining or exerting yourself. P. Progressive pattern change in your headaches. Now let's take a deep dive into headaches. Unveiling types and symptoms. Let's delve deeper into the world of headaches and explore the 3 most common types. The exact understanding of the underpinnings of migraines continues to develop, and there are many theories which include trigeminal, sympathetic, and parasympathetic nerve fibers. Please let me know in the comment box if you'd like a deep dive on this part in another video. Migraines. These aren't just headaches, but sensory disturbances characterized by unilateral, meaning one-sided, location, pulsating pain, moderate to severe, and the intensity can range on average from 4 to 72 hours. It's often accompanied by nausea, vomiting, light sensitivity, and sound sensitivity. Tension headaches, the most common form presenting with bilateral, meaning both sides, location, pressing or tightening sensation, mild to moderate intensity, and lasting minutes to days, and not exacerbated by routine physical activity. Cluster headaches. These deliver severe, unilateral, boring/stabbing pain, typically around one eye, with associated symptoms like nasal congestion, runny nose, sweating, eye tearing, eye swelling, eyelid drooping, restlessness, with no notable aggravating factors, lasting about 15 minutes to 3 hours on average. While our understanding and treatment of headaches have evolved significantly, they remain a common human experience. Now is a good time to say welcome to Beyond Wellness Academy. My name is Shah, and I'm a prescribing practitioner passionate about integrative and holistic medicine. I believe in combining the best of all worlds to help you achieve optimal health and wellness. Now let's continue exploring the topic of headaches. Part 2. Historical context. Headaches have plagued and intrigued humanity for millennia. Explanations for their cause have stretched far and wide, from the grounded practices of ancient cultures to the more fantastical. Let's embark on a journey through some truly out of this world headache hypothesis. Vedic astrology and the harmony within. Our exploration begins with Vedic astrology, an ancient Indian system with a rich history. This belief system proposes that headaches can be linked to imbalances in the body's 3 energies or doshas. Vata, which is air, Pitta, which is fire, and Kapha, which is earth and water. Planetary alignments, according to Vedic principles, can influence these doshas, potentially triggering headaches. However, it's crucial to understand that Vedic principles and practices focus on restoring balance within the body for overall health, not solely on planetary alignments. Treatments might include diet adjustments, lifestyle changes, and herbal remedies to bring the doshas back into harmony. Now, solar storms and the electrifying theory. Let's blast off to a more modern and somewhat outlandish theory. Have you ever felt a headache brewing just as a solar flare erupts on the sun? This theory proposes a connection between powerful solar flares and migraines. The idea is that these flares disrupt Earth's magnetic field, leading to geomagnetic storms. These storms, in turn, supposedly influence electrical activity in the brain, ultimately triggering headaches. While this theory sounds like something out of science fiction, a 2016 study used social media data and found no significant link between geomagnetic activity and headaches. So while solar storms might not be a major headache trigger for most people, further research is needed to explore if a small percentage might be susceptible. The journey through these historical and modern histories and theories, both grounded and outlandish, showcases our ongoing quest to understand the complexities of headaches. While the exact causes remain a puzzle, one thing's for sure, the search for relief continues. Part 3, Comprehensive Treatment Overview. From relief to prevention in terms of lifestyle, sleep, specifically poor sleep, has been linked to headaches as well as combined with stress. So, stress management is very important. Exercise, although it's difficult to ask someone to exercise during a headache, especially if it's reported as a trigger, it's, it's still important to understand that it does have a benefit, even as a preventative. Now, proper nutrition, which we'll also talk about later. Proper nutrition, especially hydration and regular eating times, are important too for relieving and preventing headaches. Some have found relief in electrolyte supplementation, even using the children's formula. Others have reported relief with facial ice baths with limes as a way to combine cold therapy to reduce inflammation and numb the area while distracting one from the pain with the ice cold sensation and with the citrus benefit of aromatherapy. And the limes are known to help reduce stress for some. It is also noted to activate the diving reflex, which reduces heart rate and redirects the blood flow from the head. Less involved tasks include menthol containing bombs such as Xandu bomb. On the physical activity front, graded aerobic exercises for 30 minutes per day is often the most common activity recommended, but yoga is also an intervention that has been studied to and has been found to significantly reduce headache frequency and intensity, period, in a few studies. Specifically, asana yoga can be used for about 10 minutes, in which one will use a mat on the floor, bend down to the knees, and bring ankles together, ensuring that your knees are shoulder width apart, raising the feet up in the air and stretching hands and arms forward, and bending your neck gently so your head will touch the floor while taking deep breaths in. Think big belly breaths, but please don't strain yourself. You can also, for another activity, while lying down on the floor, use a rolling towel to place under the neck and tuck your chin or bring your chin to your chest for 10 seconds and then extend for a moment and then repeat the process. These you can find on YouTube. There are several videos from some great YouTubers on this exact process. Regarding other treatment options, when looking at allopathic or standard Western modern medicine methods, they include but are not limited to abortive, aka rescue medications. These are drugs you take when you feel a headache or migraine starting to come on, and their job is to stop it in its tracks, aiming to quickly relieve the headache or prevent it from getting worse. They include a class of medications known as nonsteroidal anti-inflammatory drugs, NSAIDs, that include diclofenac, ibuprofen, naproxen, indomethacin, and aspirin. Also on NSAID medications such as also non-NSAID medications such as acetaminophen and caffeine are used. And these medications and their risks include gastrointestinal and kidney-related issues. Triptans are another class as well as known as 51 receptor agonists, calcitonin gene-related peptide receptor antagonists, and mean derivatives. Even more types of medications are used, including beta blockers, which are a type of blood pressure lowering medication, other antihypertensive or blood pressure lowering medications, as well as um, antidepressants, anticonvulsants, also known as anti-seizure medication. And please consider a rebound headache that might occur in up to 50% of patients, people with chronic headaches. Now, in terms of comparing the three main types of headaches in their presentation. On to supplements. Consider consulting your practitioner, whether it's your PCP or other healthcare team member, before using these. Please keep in mind that bioavailability, the body's ability to absorb certain nutrients from food sources, may be lower compared to supplements, which may not necessarily be a bad thing. A dietitian would be a great partner on this endeavor if headaches are a chronic issue. 1. Magnesium, which is found in seeds such as pumpkin seeds and sunflower seeds, nuts such as almonds and cashews, and leafy green vegetables such as spinach, kale. And there's also dark chocolate, legumes such as beans and lentils, avocados, bananas, which are also rich in magnesium and have some moderate sources, such as fatty fishes, salmon, mackerel. There's yogurt, which I consider clean yogurt, meaning unsweetened, unflavored, tofu, and potatoes with skin. Number 2, CoQ10, which is found in organ meats, fatty fish such as salmon and sardines, nuts such as peanuts and pistachios, and seeds such as sesame seeds. Number 3, vitamin D3 is known as the sunshine drug for a good reason. Exposure to sunlight is the most natural way, but be careful with overdoing it and underdoing it, which depends on the factors such as location, season, and skin tone, among other factors. Number 4, B vitamins, such as riboflavin, B2, B12, B9, B6, are components of bananas and oranges. 5. Alpha lipoic acid is often ingested via supplements as there are low to moderate amounts in dietary sources, such as red meat, leafy green vegetables, and yeast. Number 6. Omega-3 fatty acids, which have anti-inflammatory properties and are found in salmon, tuna, and sardines. Vegetarian sources include chia seeds, flax seeds, hemp seeds, walnuts, algae oil, edamame, and tofu. Number 7. Iron sources are kale, spinach, Swiss chard, collard greens, and red meat such as beef, lamb, organ meats. Please don't forget to pair with vitamin C rich foods like citrus, tomatoes, or bell peppers when you ingest iron for increased iron absorption. Now, on to herbals and non-vitamin/minerals. Each come with its own potential benefits and considerations. Ginger, and there's also melatonin for sleep regulation, and probiotics, butterbur, muswelia, feverfew, and zoganol. Keep in mind there are side effects for these treatments, which can range in gastrointestinal-related irritability and daytime drowsiness or vivid dreams, but each reaction is based on the individual's experience. So it isn't guaranteed that you'll experience a reaction or that any of these will occur to you, and you might experience others, but each reaction is important to document. And with the nutrients, it is important to work with your healthcare team for lab testing as well. And for vitamin D, ensuring that your blood levels are at the minimum between 40 to 60 nanograms per milliliter range. Now, many of these have been studied with some sort of findings. Now, in terms of mind-body techniques, they include biofeedback as it helps increase awareness of the part of one's physiological parameters, such as muscle tension and breathing. Also, mindfulness and meditation. Biomechanical techniques include physical and manual therapies that include osteopathic and chiropractic treatments, as there are also treatments that include electrical stimulation and neuromodulation. In terms of bioenergetic treatments, this includes acupuncture, which I usually am a fan of, as I have an amazing acupuncturist, but the practitioner is just as important as the treatment. So it's very important that if you do acupuncture to make sure that it is something that is conducted appropriately and is not counterintuitive to your health goals. Acupuncture is also part of this range of treatment options. Other bioenergetic treatments include Reiki, which I also am a fan of, even though its exact mechanism of these therapies have not been fully articulated, they can be incredible when they work. In terms of what to do when you have an appointment with your healthcare team, if any of these interventions have not helped you or any others that you have conducted, it's helpful if you're able to have prepared with you a diary that contains information regarding when your headache started, the frequency, the intensity, the triggers, the patterns and locations, as well as any responses to treatments that you've had, and list the treatments that you've used as well as your response to those including. I also want to include irregular sleep and activity and environmental triggers, which can also contribute to headaches, which I've mentioned a bit earlier. Another intervention in the nutrient camp is adhering to a low glycemic index diet, which is incorporated in many types of diets that you should be able to find online. And that is in line with in that hopefully is in line with your beliefs and preferences. The graded aerobic activities such as suggested for a goal of 30 minutes of moderate intensity activity with mindfulness and behavioral therapies on a daily basis and to be and to honestly to be real, 5 minutes is better than 4 minutes. 2 minutes is better than 1 minute. So at least the practice in getting your movement in a consistent manner and regimen is important. You can always increase over time. I also want to add for the herbal treatment as hops flower and betsony. Part 4. We've covered a lot of potential solutions here, and you might be wondering, can I trust this information? Well, I encourage you all to take what works for you and discard those that don't. I hope this video has been supporting you in your well-being journey, as I have been a passionate uh, practitioner for empowering people to take control of their well-being in an integrative and holistic health framework. I have been and continue to be privileged with the honor of helping incredible people manage headaches and other illnesses and symptoms for several years. Now, let's get in a little bit more into the weeds of preparing you for any other topic, such as meeting with your healthcare team and joining this amazing community. How can we help you create your personal headache relief plan? By the way, if you're interested in joining a supportive community and getting notified when I release new content on integrative and holistic health, hit the like and subscribe button. Your role in preparation for healthcare visits, managing headaches is a proactive journey. As mentioned a little bit before, keeping a detailed headache diary can be invaluable, especially when discussing your condition with healthcare practitioners. Again, please make sure to note the onset of the headaches, the frequency, intensity, triggers, and your responses to any treatments you've tried. Part 5. Interactive conclusion. Sharing your journey and building community. We explored the fascinating world of headaches, from the cosmos to earthbound actions such as yoga, poses, stretching, facial ice baths, and supplements such as butterbur, magnesium, and even hops, which contains antidepressant properties. Now armed with this knowledge, you can take a holistic and integrative approach to managing your headaches and find the relief that works best for you. Remember, there's no one-size-fits-all solution, so explore different options and create your own integrative headache relief plan. I'd love to hear what are your headache go-to treatments in the comments section. If you're interested in joining a positive community passionate about embracing integrative and holistic health practices, don't forget to hit that like, subscribe, and notification bell. In the meantime, you can check out my next videos below. Thank you.